Sue Schroeder, and I'm a nurse and work on adolescent mental health at Abbott Northwestern Hospital. I've been a nurse for 43 years, 23 of them at Abbott Northwestern. I've been both a formal and informal leader throughout my career. I've actually loved nursing through the challenges of evolving healthcare and increasingly complex care in the hospital systems in the last 43 years. I value the time that I get to spend with patients and families, teaching them the strategies they will need to weather their medical or mental health care crises. In the spring of 2021, Abbott Northwestern Hospital, a part of Allina Health, decided to change the staffing ratios across the 4 mental health units so that individual nurses not only had the responsibility for the care of a greater number of patients, but also to assume some of the responsibilities of our support staff. On the child adolescent mental health unit, it meant more responsibilities and fewer nurses to support and to teach the children strategies to manage anxiety and depression while managing their emotions in real time. It also meant fewer nurses to maintain safety for our patients and staff during behavioral crises. Complicating this picture is the complexity of the mental health system in Minnesota. The child adolescent mental health unit at Abbott Northwestern Hospital was designed as an acute stabilization unit. This means that patients coming to the hospital for mental health challenges such as suicidal ideation, self-harm, and psychosis would typically have a stay of 5 to 7 days. During this time, kids can be stabilized by learning skills to manage anxiety and depression, and it also gives them some respite from the environments that were contributing to their crisis, be it at home or school or the community or the streets, before returning to their community. Over the course of the last approximately 2 years, we've been admitting more young people with more complex mental health needs, requiring longer hospitalizations. They're the kids who are often challenging to find placement for because of drug addiction, violent behavior, or chronic difficulty functioning at home, at school, or in the community. This new mixture of acutely ill and chronically ill children and adolescents on our mental health unit has created a new and dangerous mix, an often volatile mix of patients. From February through December of 2021, there were 33 assaults of nurses and support staff on the 4 mental health care units at Abbott Northwestern. These assaults are due to patient violence during behavioral crises. 17 of these injuries were sustained by nurses, 16 of the injuries were sustained by support staff. 9 nurse injuries have been severe enough to require staff to take extended medical leave to recover from their injuries, and 5 of these nurses continue to experience serious and lingering effects from their assaults. Despite this trend of assaults and injuries, there have been no changes in the staffing patterns that would support staff in maintaining greater safety. This is unconscionable, and all of this has been happening in the context of a pandemic. It is frustrating to me to be faced with the dilemma of trying to care for some of the community's most vulnerable children, adolescents, and adults on the 4 mental health units without the resources that we need to successfully and safely do our job. The moral injury that nurses sustain by being unable to care compassionately and safely for our patients impacts us across all communities of the hospital. Every day, our focus is on attempting to keep both patients and staff safe. It is exasperating to me that the executives at Allina Health who are responsible for these staffing decisions are those who could not possibly be further from the bedside or the consequence of their decisions. If one pays attention to patterns of behavior as a predictor of future behavior, hospital executives and administrators are unlikely to respond to these stories in a meaningful way. In the 43 years I've been a nurse, I have not observed a pattern in which resources were increased to help staff manage increasing acuity of the patients over the course of time. I'm well aware that the hospital lobby is large, powerful, and well-funded. We are all well aware that nurses having to care for more patients is a money-saving tactic for the corporation, despite Allina executives earning millions of dollars. But it's also a tactic that is causing nurses to become demoralized, to leave hospital nursing, or to leave nursing altogether. It is creating nursing shortages that profoundly affect communities in which we serve. We don't need the nursing compact. We need protection for Minnesota nurses so that they can feel safe to return to the bedside to care for Minnesota's most vulnerable citizens. Our ask is that the Minnesota State legislators support MNA legislative proposal, keeping nurses at the bedside. This is not a one-size-fits-all solution to legislate nursing ratios overall, but a thoughtful process that would allow nurses to have a voice in the process of staffing ratios based on patient acuity in each hospital. With this system, we could more safely do our jobs, avoid moral injury, support nurses at the bedside, and increase the overall health, safety, and satisfaction of patients, nurses, and our community. I really appreciate the opportunity.
Thank you so much for your testimony.